Emotional and Behavioral Disorders by Shahreen. Presentation is divided into definition, causes, characteristics, ADHD, data and statistics, assessment, educational approaches, and references. Definition. The term used in Idea 04 for emotional and behavioral disorder is known as emotional disturbance. It is characterized by one or more behaviors that alter a child's school performance. Emotional disorders are also referred as psychological disorders that affect the emotions. Children with emotional and behavioral disorders have a difficult time getting along with peers, teachers, or parents. Symptoms include aggression, impulsive behavior, withdrawn, unhappy or depressed, poor appetite, nervousness, anxious, or mood swings. Emotional disorders can be divided into three groups. Externalizing behavior is directed towards others by acting out, such as tantrums, hostile, ignoring teachers' reprimands, threatening physical harm to other people. Internalizing behavior is directed inwards. Examples: withdrawn, depressed, suicidal, low self-esteem, extreme phobias, and panics. Low incidence disorders occur very infrequently but are serious when they occur. Example: schizophrenia, characterized by a separation between the thought process and the emotions, and a distortion of reality accompanied by delusion and hallucinations. There are three causes. Biological. Certain emotional disorders such as mood, depression, and schizophrenia may have a genetic foundation. Home and community. Negative experience in combination with poverty, abuse, neglect, parental stress, inconsistent expectations and rules, and turmoil can lead to emotional disorders. School. Teachers' expectations, insensitivity towards students, and unorganized classroom structure can cause students to become aggressive, frustrated, and withdrawn. Characteristics: hyperactivity, trouble staying still, aggression, acting out, fighting with others, withdrawal, failure to initiate interaction with others, excessive fear or anxiety, immaturity, temper tantrums or inappropriate crying, learning difficulties, academically performing below grade level. Attention deficit hyperactivity disorder is a condition in which a person has trouble paying attention and focusing on tasks, tends to act without thinking, and has trouble sitting still. It may begin in early childhood and can continue into adulthood. Treatment may include medicines and behavior therapy. Medicines such as Ritalin and Dexedrine are prescribed to increase attention and decrease hyperactivity. These medicines may cause side effects such as loss of appetite, headaches or stomach aches, twitches, and problem sleeping. ADHD has three main characteristics. Inattention. Fails to pay close attention to details. Has difficulty sustaining attention in task or play activities. Does not seem to listen when spoken to directly. Hyperactivity. Fidgeting with hands or feet. Does not remain seated when expected to. Has difficulty playing or engaging in leisure activities quietly. Impulsivity. Talking excessively. Blurts out answers before questions are completed. Has difficulty waiting his or her turn. Interrupts others. Here are some data and statistics on ADHD. 4.5 million children 5 to 17 years of age have been diagnosed with ADHD as of 2006. 3 to 7% of school-age children suffer from ADHD. Boys are more likely than girls to have been diagnosed with ADHD. 7.8% of school-age children are reported to have an ADHD diagnosis by their parent in 2003. Diagnosis of ADHD increased an average of 3% per year from 1997 to 2006. As of 2003, 2.5 million youth ages 4 to 17 years, 56% of those with the diagnosis, were receiving medication treatment for the disorder. Rates of medication treatment for ADHD vary by age and sex and range from 0.3% to 9.3%. Assessment. The main purpose of assessment of children with emotional disorders are to identify and place students who are at risk for emotional disorder, monitor student progress, provide necessary intervention and instruction, Set up short and long-term goals and strategies for intervention. Document the effectiveness of different intervention efforts. And gather relevant information about the student and social and instructional environment. Here are some educational approaches. Teachers should use few commands to teach and manage behaviors. When planning instruction, teachers should always keep in mind that individual students have different goals. Teachers should be prepared by having all materials ready before beginning the lesson. Get the student's attention in a creative way. Teachers should use clear instruction and provide direction to the lesson orally and in writing. Teachers shouldn't go through the lesson too fast so that they might lose the student's attention. Teachers should see students away from distractions such as doors, windows, and computer stations. Teachers need to provide a few minutes before changing from one topic to another. Teachers need to always remind students about clearing the desk, keeping pen and paper on top of the desk, and lining up in small groups. Teachers need to enforce about classroom rules. Teachers need to give specific praises for good behaviors and be consistent with consequences. Teachers need to encourage peer interaction by assigning a buddy. Help is also available from psychiatrists, psychologists, and other mental health professionals in public or private mental health settings. Students eligible for special educational services under the category of emotional disturbance may have IEPs that include psychological or counseling services. These are important related services which are available under law and are to be provided by a qualified social worker, psychologist, guidance counselor, or other qualified personnel. Children should be provided service based on their individual needs. Here are the references used for this presentation. You may check out the websites for more information. Thank you.